Hi everyone, my name is Samantha. I've been a nurse for a little over 2.5 years, and today I would like to talk to you about one change I would like to make in today's healthcare system. I would like to include more patient engagement strategies in our healthcare system today. Patient engagement strategies have been shown to improve quality delivery and translate into better outcomes related to patient satisfaction and recovery. The nursing profession's role in patient engagement and advocacy is key to the care that we deliver and continues to evolve to meet the needs of patients. An example I came across today. If you think about it, most patients that enter a surgical suite to have some sort of surgery done are bombarded with anxiety and look to the surgical team for guidance and security. The author of the article that I read believes that inaccurate portrayals of surgery and anything related to medicine contributes to the patient's portrayal of the surgery, and it's not always in a positive way. The best example I could think of would be a TV show like Grey's Anatomy or anything like that can portray surgery sometimes in a false way. Patient engagement and patient satisfaction are playing critical roles in a changing healthcare system and the emerging compensation models. This directly impacts both the inpatient environment and the ambulatory care setting. We would know that the change has improved the system because there should be less unnecessary hospitalizations due to the increased knowledge that patients have from being more engaged in their own health care. More so now than ever, the quality of patient care is reflecting the patient outcomes and is actually affecting hospital reimbursement. Money is a big issue in the healthcare setting, and ways to reduce costs are always being thrown around. According to the Sullivan text, quality nursing measures can reduce costs. An example: the time nurses spend looking for missing supplies or lab results, the cost of agency nurses because of unfulfilled positions, and delays in patient discharge due to a lack of coordination or an adverse event. If you think about it, all of these issues really can be avoided. Moving on to the electronic medical record. Moving away from paper charting and paperwork is improving the quality of care. These electronic medical records allow the patients to have all charts, to have all of their medical history and etc. in the same place. It allows the physicians and nurses to stay on the same page as to how the patient's care is progressing. We recently started using Epic at my facility, and it's really turned out to be a blessing. I think it's a no-brainer that an increase in nursing staff results in better patient outcomes. With a lower nurse-to-patient ratio, though, comes the issue with increased costs. I believe you really have to weigh the benefits of reduced patient mortality, fewer infections, and shortened length of stay in the hospital that accompany having more nurses rather than the cost. Although I believe functional nursing to be one of the best models, I believe a team nursing approach will need to be in place by 2020. A stem from functional nursing, a team approach appeals to me because a team of personnel provide total patient care to a group of patients, not just one person is responsible. The team that acts as a unified whole has a holistic perspective of the needs of each patient. One thing that needs to be reiterated is communication skills are key when using a team approach. What type of restructuring activities will my organization need to be involved in over the next several years to be ready for 2020? Well, there will need to be an effort to provide more patient-centered or focused care, an improved effort at providing appropriate amount of staff for each unit, and a continuation of cost effectiveness while maintaining high quality patient care. And the criteria to use to evaluate effectiveness of a nursing care in the organization would be credible, objective, and non-political surveillance and reporting of quality in health and healthcare, and it must be explicitly voiced and strongly applied as changes take place, which would include informing patients, families, and employees about the healthcare decisions and choices they face, identifying and possibly eliminating some standard performers, those whose performances so far below an acceptable level that immediate actions are needed, highlighting, rewarding, and broadcasting best practices, and monitoring and reporting information about changes in quality over time. Thanks for your time.